Thank you so much for joining us today. I'm Sally Pace, and our team is the creators behind the Granite List. A few years ago when we started the Granite List, it was designed to be a needed resource for benefits leaders. It was designed to help you cut through the noise and clutter and streamline the process of finding solutions. Today, the site has grown to be the most trusted resource for benefits leaders who are searching and sourcing for new solutions. And we've seen that become evident as we culled our list of most searched topics. Today's is certainly near the top of that list. You all already know that employers are being pressed to deploy solutions around GLP-1s, weight loss, lifestyle management. So I can think of no better person to address this topic than Dr. Jessica Lee. Soon you'll hear from her on strategies that you need to be considering. As CEO of Tria Health, Jessica is driven by her PharmD experience to revolutionize patient-centered care and improve health outcomes for those suffering from chronic conditions. She's a doctor of pharmacy with board certification in psychiatric pharmacy and an executive master's in business. And she is no stranger to this space. She lives it every day. So with that, I'm going to turn it over to you.
Thanks, Sally. Well, obviously, this is definitely one of the year's most searched categories. As I was preparing over the last couple of days, I, as a pharmacist, get asked on a regular about these drugs for people's own purposes, for employers asking about what my thoughts are. So I definitely am excited to share a little bit more today about some of the knowledge that we have around GLP-1s, but also to talk a little bit about some things that you should be thinking about in your strategy for a category of drugs that has been sort of around for a while, but is not going away anytime soon. And even to talk a little bit about some disease states that we really haven't talked a ton about before. But who to lead me into this better than Oprah? I mean, everyone, if you were near a TV last night, Oprah decided to host a show last night talking a little bit about the use of GLP-1s in obesity. And so let's just kind of talk a little bit about where we've gotten from in the past to where we are now and sort of where we're going. So if you'll change to the next slide, Sally, I'll talk a little bit about the trends that we've seen in GLP-1s. We'll talk a little bit about sort of the concept of diabetes and obesity because these drugs are being used up across categories. We'll also talk a little bit about the cardiovascular conundrum that's starting to spin in a little bit too with it. And then talk some about potential opportunities to reduce member disruption, some ways to look at how we can make this a long-term effective strategy for you as an employer, and then things you should be thinking about when you're looking for the right partner to help you as you think about your obesity management and diabetes strategy going forward. Let's talk a little bit about GLP-1s. GLP-1s are actually a category of drugs that we call incretin mimetics. They are a hormone-esque like drug that really focuses on helping to release, they're mimicking a hormone that helps to release insulin from the pancreas, which is really where we got the start with these drugs. And some of these drugs, surprisingly, some of you may be surprised, we've had some of these drugs around since 2007. FDA approved our very first GLP-1 in 2007 for the treatment of diabetes. Because of that mechanism of action of helping to enhance the release of insulin from the pancreas after you eat. But what happened is that these drugs, because of the way in which they work, they're not easily replicated, they're not easily tolerated, and also they require injectable sort of mechanisms, sort of at least now at this point. And people are also challenged with the fact that they're not exactly readily available in the bloodstream if you take them any other way. And how long they last in your bloodstream is really important too. So over the years, everybody's on the race to find the perfect drug for this. And no better than for us to remember the world of sort of in the 2017 arena when Ozempic was sort of released. I think it's probably the most notable GLP-1 that we have. You can hardly say the name without singing the jingle. So good on the marketing team that created that. But that was when we really started to first see sort of the enhancement of the use of these drugs for diabetes. So 2017, FDA approved Ozempic. We now had a once weekly medication that you could inject So we're not talking about daily injections, a once weekly injection. And the other thing that we saw with these was not only were they getting good blood sugar control for individuals who had diabetes, but we were also seeing some improvement in weight management for these individuals. A lot of times, not always, if you have type 2 diabetes, there's some obesity that may go along with that. And that's generally related to a lot of different mechanisms as it relates to the way insulins work in your body and the way insulin interacts with the way in which you eat things. So we were seeing some trends in the launch of Ozempic coming out. And you started to see utilization go up, but not 100%, right? Like we're not seeing, if you look at that top corner, you see some Google trends. And you can see that Google trends for the words related to Ozempic, semaglutide, Mounjaro, Wegovy, it started to just launch in 2022. Well, what happened prior to 2022 was that in 2021, we had two significant things that happened. The first is the sort of release of Wegovy. So Wegovy in June of 2021 was approved by the FDA for the treatment of obesity. Wegovy is the same active drug that's in Ozempic, but the FDA, not uncommonly, this happens for drug makers. They'll take a drug and they'll find another way in which it works or a different disease state for which it works. They'll study it and then the FDA will approve it for that. And so that's what we happened with Wegovy. In June of 2021, we finally got approval for the treatment of obesity with semaglutide, and it is now branded as Wegovy. Prior to that, though, there was starting to be some what we called off-label use of Ozempic in the arena of obesity. So you're starting to see in early 2022, people start to talk about it. And that's where you'll see sort of direct marketing campaigns, media was really starting to take a hold of it, and marketing in general was starting to bring up the word Ozempic a lot more, and then Wegovy got some attention as well. But the other significant event that happened in 2021 is probably the one that's most important as it relates to the treatment of diabetes. In 2021, the American Diabetes Association prioritized the role of GLP-1s in their guidelines. So if you look at the American Diabetes Association, they help physicians, particularly endocrinologists, and maybe sometimes primary care physicians, who are a lot of times doing some prescribing in the treatment of diabetes, with some guidelines on what to do with individuals who have specific patterns in their diabetes. So it generally recommends starting with a drug metformin, which we're all familiar with. It's a very inexpensive drug, and it's a really good place to start because it has a lot of good success for individuals who are treating diabetes. But what happened in 2021 is that they moved up this category of drugs, GLP-1, to sort of second-line therapy. Now, obviously, that doesn't mean that that's for everybody, but what happened was it brought a new light to the efficacy that they were having with GLP-1s in reducing blood sugar for treatment of diabetes. The other thing that they were noticing during that time with the treatment of Ozempic in diabetes was that we were actually having a lot of success, also having some weight loss. And if any of you are familiar with the treatment of diabetes, a lot of the challenges we have for individuals who have diabetes is that some of these medications actually can cause people to gain weight. So having something that actually was also enhancing weight loss along with promoting the efficacy of lowering the blood sugar to where we needed to be was really a win-win. And that's why we saw the use of these drugs sort of move up in treatment guidelines. So not a surprise based on all of these trends that we all now know and are hearing a lot about GLP-1s. As employers, you're also knowing a lot about these drugs as well, because now they're creeping into your top 5 medication categories. And we're not talking like specialty or anything, we're talking top 5 spending and utilization. So if you want to go to the next slide, Sally, I want to talk a little bit about like how these two disease states sort of overtwine and what we're having. Employees are obviously looking for answers as well. And they're hearing about these medications. They're hearing about the use of these drugs, not only in diabetes, but also in the treatment of obesity. And the reality is that it's really, really critically important to remember, first and foremost, that these are medications. As a pharmacist, sort of in the beginning, when you start pharmacy school, the number one thing that they talk about is the fact that medications have good and bad. Every medication has a side effect and a benefit. And the drugs that work best for you as an individual is the one where the benefit outweighs the side effect or the bad effect or the negative effect. And that's not any different with these GLP-1s. The reality is these drugs are very effective. I've just sort of talked about why we're seeing them being utilized. The ADA obviously saw the value. Physicians are seeing the value of these drugs, not only in the treatment of diabetes, but in obesity. So there are some good things that are happening with these drugs. But the challenge is that these drugs aren't for everyone. And they're not a one size fits all, nor are they an easy button. And that's the biggest thing we have to overcome when it comes to the treatment of these medications. And I think we have to talk about in terms of education of the use of these medications. So if you look at the sort of diabetes management, we as pharmacists have always been focused on ensuring that the drug gets to the right patient at the right time for the right reasons. And that is exactly why the conversation around the journey of health on your diabetes management should be all-encompassing and holistic. There are many things that make these drugs right for people who have diabetes and or people who have obesity, but it's really weighing in on the side effects and overall effectiveness as it relates to the previous treatments you've had, what you're doing non-pharmacologically to ensure and support the outcomes related to it. And additionally, utilizing these drugs for GLP-1 also are showing us, and what our pharmacists were seeing mostly in our arena, was that once you started to use some of these medications, the opportunity to help begin deprescribing for individuals was really, really important, because we were starting to see people have blood sugar control, effectiveness, they were losing weight. And then what happened was they were on 2 or 3 regimens, and the reality is that they begin to discontinue things and improve not only the use of these medications, but simplify the regimens and also improve the opportunity for cost savings for both the member and the plan. However, it's also important to go back. If you want to go back 1 second, I have one more thing to state on that. However, also in the obesity arena, it is no different when it comes to the use of medications. We've had medications in the anti-obesity treatment for years. The challenge we've had with the medications in the anti-obesity treatment is that the reality is they haven't been super effective. When we see these medications being used in obese patients, we are seeing anywhere from a 15 to 17% reduction in weight loss. Now, caveat with that is that when we saw those types of results, those individuals that were in those studies were being treated alongside a very effective nutrition regimen and an exercise regimen. So the reality is that while these medications are effective, we're constantly needing to also do the education on what it is important is for those individuals to do alongside the medication. Medication can't be the easy button. And so when we, as pharmacists, work with patients who are in a weight loss management program alongside someone who's supporting their behavioral changes, their nutritional conversations, and their weight loss challenges, we're able to also ensure that the medications are used appropriately and safe. If it's right for the patient, and it depends on that particular individual, that pharmacist, and that physician who's working on that individual's obesity management program. So if you look at the next slide, what's really important is that employers have a strategy. Employees are pushing for coverage. We've seen studies and surveys being done by employers and employees where they're saying it's like one of the highly sought after desired job benefits. And the reality is that it's really important as employers that you need to think about the culture and approach to obesity management for your employment team. Like your benefits team needs to think about how it is that they want to approach the treatment of obesity. It is clear that obesity is beyond just a lifestyle thing for some people, a lifestyle approach for some people. The reality is that there's multiple components, including behavioral components. There is sometimes a psychological component, and there's many times also sometimes a medical component to that as well. So the reality is that it's really important that we focus on implementing the right things. It starts with prior authorizations implemented from the PBM. Obviously, working with your PBM to ensure that if you're talking about diabetes management, that the individuals who have diabetes are getting the right meds at the right time. But it's also thinking about how you want to approach the coverage of obesity medications. And the reality is that it's really important to ensure that if you choose to have an obesity strategy at your place of employment where you're covering benefits, that you think about that it has to be a multifactorial approach. It's not an easy button. And the reality is these medications are being also consulted and concerned. There's concern about the use of these medications long term. We're seeing that if you use these medications, the concern is that there's a huge amount of weight gain that occurs after a year in some of the studies. And the reality is that we're also seeing these drugs getting approved for the treatment of cardiovascular complications. But it shouldn't be lost on the fact that medications should never be an easy button. And the reality is that these medications need to be combined with a very specific individualized weight loss nutrition component, weight loss approach from a behavioral component, and also a mental health approach to it as well. And these three things are really critical to ensuring and having an effective plan for moving forward. If you don't have those components alongside an individual who's choosing to lose weight for the treatment of obesity, along with a clinician who knows exactly how these medications should be tapered up and down, and even work alongside other medications, because we know these individuals who are being prescribed these medications for both diabetes and obesity have multiple other medications that they're using for other comorbid conditions. If you move to the next slide, we can also talk a little bit about the fact that it's really important to look at the best strategy. So the right approach for the employer is to get the culture set. How do we want to treat or give resources to our members who have obesity? Managing weight loss medication and weight loss utilization should really start with, do we have a strategy around giving people the resources they need for nutrition, diet, exercise, behavioral components? That's the place that starts, because that's the framework that allows you to then build upon that. But then the medication should be a component of, if you choose to cover medications for your benefit, understanding the potential use of those medications, the budget around those medications, and then the long-term strategy around those medications is critical, because that will then allow for you to plan for how to ensure that you're providing a benefit that not only covers the lifestyle, but also covers the clinical component that needs to happen. So having a clinician work alongside the behavioral component to ensure that these medications are safe, effective, and appropriate, and being used for the right people. At the end of the day, being educated on them is half the understanding of how to move forward with these as well. Regular monitoring with these medications is critically important, not just for your individuals who want to use these for obesity, but also for those who want to use it for diabetes. We have worked with many patients who are on these medications for the treatment of obesity. And the thing that we find most important is to have conversation about side effect expectations, how to avoid side effects, how to improve side effects, what to do when you have a side effect. A lot of times we're hearing catastrophic issues related to some individuals being hospitalized or going into the ER due to significant GI effects. A lot of times, sometimes those people maybe unexpectedly had those side effects, but a lot of times having a conversation up front about what to expect with these medications alongside the primary care physician is critical to ensuring that you are potentially planning for and expecting those events, because they may be already predispositioned to those particular side effects as well. But for those with diabetes, these GLP-1s can be sort of revolutionary as well. So having a strategy for ensuring that they have a coaching component from a nutritional perspective, but also a coaching component from a clinician or a PharmD who can help ensure that those medications are being safe and effectively used. So once again, just to cover from a comprehensive strategy solution, we've talked a little bit about why these medications are effective and why they're gaining popularity. But the reality is that first and foremost, as an employer, you need to have a strategy on how you want to treat obesity. It needs to start with a preventative approach, ensuring that individualized management is occurring. Each individual has a different sort of approach to the way in which they're treating their diseases. So one size doesn't fit all. working with supportive health coaches to focus on nutrition, diet, and exercise, but also having a very supportive integral team member from the pharmacist working alongside the primary care physician to ensure that the patient has a good understanding of how these medications approach the treatment of obesity and diabetes is critical to a long-term strategy. Additionally, I will only state that learning and figuring out what the best strategy is for your benefits now as it relates to obesity and diabetes is really critically important. As we know, the GLP-1s that we're talking about now in terms of their popularity and their cost are not only going to just increase in terms of the utilization and cost for your plan, but we're going to continue to see in the pipeline. If you look at the pipeline of medications coming down the anti-obesity treatment, we are going to continue to see additional medications that will have efficacy in the treatment of obesity that may even be of more concern from a cost perspective. Starting with a strategy that fundamentally focuses on the individual, ensuring they get the best approach, along with providing a clinician that ensures that the individuals who utilize medication are getting the best medication for them with the right approach from a nutritional lifestyle management is the key and critical focus for employers to think about when it comes to providing a comprehensive solution. Tree Health has been in the business of ensuring that pharmacists are a part of a patient's individual journey in healthcare for a long time. And this is no different for us. We have been working for over 5 years in the weight management arena, trying to ensure that individuals who have obesity are working towards improving their outcomes. And we've been working with these medications even before GLP-1s were a part of it. I think it's important for you to consider ensuring that if you are going to add medications into your obesity management strategy, that you ensure that you have the right resource working alongside these members to ensure they get the best outcomes as it relates to their care management and holistic management as well. I'm sure we have some questions that have probably spurred from that. And if you have questions about how TRIA works alongside as a partner with the plan and alongside members, obviously here's a great way for you to reach out. And I'm also willing to take any questions at any time for the specifics talk and anything about medications in general.
Well, so we actually have one that has tapped into your professional background, come through the chat. As a pharmacist, what are some important things people might not understand about taking GLP-1s?
Yeah, I think, everybody's talking about the nausea and the inability to eat. So that's something that people are definitely hearing about. But one of the things, there's two things that I think are critical. One is always understanding the expectation of when you start the medication. These medications, you got to start low and go slow. And I think from an easy button perspective, sometimes people want to get to the end result of the finish line really quickly. Using these medications in a slow way allows for ensuring two things. One, that you're tolerating the medications appropriately, but also that you're losing weight in a way that allows for sustainable long-term success. I mean, it's always fun to talk about how someone's lost so many pounds in the first week, but really a half a pound to a pound a week is really key. The other thing is the importance of ensuring that when you're using these medications that your prescribing physician is someone is integral into your other medications and disease states. I think a lot of people don't understand the importance of educating anybody that you're working with from a physician's perspective that you're on these medications. We've had lots of patients who have been surprised by the fact that when they go to have like a knee replacement or something, because they're working on other challenges in their healthcare journey, that these drugs need to be evaluated and stopped prior to surgery due to many complications that occur. So I think overall, one, these medications need to be talked about, especially with your physicians if you're being treated for other disease states. Two, you need to be managed appropriately, and talking to a pharmacist to ensure that you're managing the side effects to achieve the best outcomes is critical, and that they don't work for everybody. So that's the other unfortunate challenge for some people.
Okay, this next one is one that we've heard a lot lately. Is it legal for a plan sponsor to omit GLP-1s from their covered formulary?
Okay, wow. First and foremost, Sally, I want to remind everybody that I did get my pharmacy degree but my law degree is not one that I have obtained. I am a lifelong learner, but I do not have my law degree. The way that we currently understand the coverage of these is these drugs currently in the obesity approval, FDA approval, are non-essential. The obesity approved drugs are a non-essential drug benefit. So as a self-insured employer, it is our belief, my belief, that these can be omitted from the coverage at this point. That being said, obviously, each employer needs to take that strategy into heart and consult their attorneys on how they want to move forward. But being a non-essential benefit is critical. I do think this conversation is going to change, Sally, and we're going to continue to have conversations about these drugs because we're seeing, and I talked a little bit about it, but these drugs that Wegovy just got approval for, a secondary approval for cardiovascular prevention. So we're going to see conversations around these drugs in terms of their essence in the treatment of obesity as we go down, but at this point, they're still considered non-essential benefits.
So a follow-up to that is how can the prescribing MD be policed to make sure the required the plan requirements are being followed?
Yeah, that's a tough one. I think ensuring that on your benefit coverage, that you are able to sort of create a situation where coverage of the drugs from an obesity perspective are being accessed alongside the requirement of some type of a lifestyle management program is critical. And ensuring that you are being allowed to ensure that the right people are fitting it. So they really should be the right fit. These drugs aren't lifestyle, these aren't drugs for people who want to lose 5 pounds to go to the beach. These are drugs for people who have severe obesity. So I think ensuring that the access to these drugs from an anti-obesity perspective are really focused on ensuring the right person gets the drug. So having some level of BMI commitment to that. And, FDA approval has guidelines around that, but also that the access to these drugs and the continued access to these drugs are tied to an engagement in a long-term lifestyle behavioral program that's focused on nutrition, diet, exercise, and behavioral changes.
Right, more coming in. What have you seen in terms of this drug's intervention cost benefits analysis?
Yeah, I mean, I think right now, when you talk about ROI or risk benefit or cost benefit analysis, the amount of time for these medications to be at the place where we're seeing a return on investment or a cost effectiveness is longer than, in some employers' cases, the average retention time or the average tenure time. So I think at this point, if you are choosing to have a lifestyle or obesity management program, it's a little bit of the plan, the desire to provide a resource to your members and recognize that this is about a long-term journey to improving the health of your membership, and that it's not going to be that your ROI is XYZ by year 1, year 2, and year 3. Everybody starts at a different set point, and each person takes a different amount of time to get to the weight loss that they need to be effective. And so those are the critical components that are difficult for us to give a really good ROI conversation on. But overall, it's about providing a solution that is getting the right people on the right drug and leading them through a long-term behavioral change that makes them want to be a part of it.
One more that has come through. Wegovy was just approved for a new indication, cardiovascular disease. Do you foresee additional indications, and couldn't these positive results on other comorbidities being seen by manufacturers just be the results of losing weight?
Well, that is a great question. And obviously, I do think there are some components to that, but what they're showing in the studies, where the study of 17,000 patients where Novo was allowed to get the coverage of obesity or a coverage of cardiovascular secondary coverage of that, was that they are seeing some of these cardiovascular prevention benefits happen a little bit before significant weight loss. So Do I know what's coming first, the chicken or the egg? I don't know that I have an answer for that. But I do believe that some of the other indications that we may be seeing come down the pipeline, such as fatty liver disease, are probably somehow tied and related to the overall improvement of obesity and blood sugar in the overall homeostasis or level setting of your body. So while I'm not exactly sure which is the first or the second, I know one thing, we're going to see more indications for these drugs. And overall, if you can improve people's, body metabolic levels, you're going to see improvement in many reduction of other chronic conditions beyond just the three that we've just alluded to.
Well, thank you so much for not only being part of the Granite List community, but for being willing to share about this highly searched and highly important topic that is impacting the bottom lines and the waistlines of so many employers and employees across the country right now. Thank you all for attending. I want to encourage you. Hopefully you have already signed up for our weekly newsletter at thegranitelist.com. But if you haven't, you can join the 15,000 plus benefits leaders that receive it every week.